Hey there, this is Dr. Stephen Cantor of TriMed Spine and Joint. And if you're watching this video, then you've taken the first step to treating your neck pain, back pain, arm pain, and/or leg pain. Over the next 6 minutes, we will break down the vertebral column, bulging discs, herniated discs, degenerative disc disease, and how and why the DRX9000 treatment is so effective at treating these things. The spinal column or backbone is one of the most important parts of your body, as it provides you the ability to stand upright, bend, and twist. "33 individual bones interlock with each other to form your spinal column. The vertebrae are numbered and divided into 4 main regions: cervical, thoracic, lumbar, sacral coccyx. C1 through C7 cervical vertebra form your neck, and it supports the weight of your head and neck. T1 through T12 are your thoracic vertebrae, and they connect with your ribs to form the rib cage. Lumbar vertebrae, L1 through L5, carry most of the weight of your upper body and provide a stable center of gravity. Your sacrum and coccyx make up the back wall of your pelvis. Intervertebral discs are located in between each of these movable vertebrae, and the disc consists of a rubber band-like outer ring with crisscrossing fibers called the annulus fibrosus. The annulus surrounds a gelatinous-like center called the nucleus. The discs function like shock-absorbing springs, where the annulus pulls the vertebral bodies together against the elastic resistance of the nucleus. When you bend, the nucleus acts like a ball bearing, and that allows each of the vertebral bodies to move in all different directions around this gel. Each disc works together with 2 facet joints to form a spinal motion segment. The biomechanical function of each pair of facet joints is to guide and limit the movement of the corresponding spinal motion segments. The surfaces of these joints are coated with cartilage, and that helps each joint to move smoothly. Directly behind the disc is the spinal canal or neural canal. The spinal cord and nerves pass through the spinal canal, and that protects them from injury. The spinal cord is the major column of nerve tissue that's connected to your brain and serves as the information superhighway for all of your body functions. The nerves in your spinal cord branch off to form pairs of nerve roots that travel through small openings between each of your vertebrae called foramen. This is what a normal vertebral lumbar disc looks like. Degenerative disc disease is the loss of disc height as a function of aging. When the gelatinous-like nucleus pushes against the outer annulus, it's called a bulging disc. We've all heard these terms. When that gel-like cord pushes out through a tear in that fibrous wall, it's called a herniated disc or pinched nerve. These conditions may impact these surrounding nerves, causing sharp, severe, and/or debilitating back pain. They may also cause neuropathy, sciatica, or other painful symptoms. The DRX is a highly effective, non-surgical, drug-free treatment for all of these conditions. The DRX machine is the world's first disc therapy that is able to target a specific disc level. So if you have a herniated disc at L5, we can target L5. It adjusts itself 13 times per second and pulls using a logarithmic curve. This is what ensures that each patient experiences an ultra-smooth treatment that's delivered with consistent precision. Research and findings by MDs associated with various medical institutions such as the Mayo Clinic, Stanford Medical School, Johns Hopkins, all reveal that patients who qualified and underwent the DRX treatment had an incredible 88 to 90% success rate. A comfortable DRX9000 treatment takes about 30 minutes, and during this time, the pressure inside the disc is dropped by more than 200 millimeters of mercury, which creates a vacuum or a suction-like effect, which pulls fluid and nutrients back into the disc, rehydrating the disc and restoring its height. In the case of bulging discs, the incredible negative pressure created inside the disc by the DRX9000 brings the nucleus back towards the center and off of the painful nerve. And that's the important part. In the case of a herniated disc, same story. The gelatinous-like nucleus comes back towards the center and off of the painful nerve, so you no longer have a pinched nerve. These results have been proven time and time again in pre and post MRI findings.